Hello, hello, welcome everyone. Today is Sunday and this is the Magnum Physical Therapy Show. Last Sunday was our first appearance. We took some feedback and today we're going to organize things a little bit differently. Today's topic is going to be about the knee and the medial meniscus. And we're going to take you through it in a way where we talk about a specific person in mind. This is a real patient, a 60-year-old female. We'll talk about knee mobility in terms of range of motion. We'll talk about strength training. We'll talk about how do you do cardio, and then how do you apply this to the patient, and also how would you apply this to yourself in case you have a meniscus issue, or hey, you know what, it's good to know. I'm sure you're going to run into someone that has a meniscus issue. And also, just so you know, if we can hit 1,000 likes, I will feed my fish. And FYI, I feed my fish every day, just saying. And then if we can hit 10,000 likes, I will feed my stingray. Yes, you might actually see him kind of floating around. But yeah. Anyway, so how's everyone Sunday doing? I also wanted to mention that if anyone has any questions, please feel free to drop it in the comment section. I'll do my best to answer it today, but if I don't, I'll make sure to answer it at the next live. Okay, so today we are going to be talking about a 60-year-old female. Her issue is her right medial meniscus, or her right knee. What happened was she had a fall. Kind of unfortunate, right? But it is kind of typical around 60-year-olds. So she had a fall getting out of her car, and she started experiencing tenderness right on the inside of her knee, to the point where she had a hard time walking, she had a hard time going upstairs, going downstairs. So she went to the orthopedic. Orthopedic took some imaging and shows that she has a complete medial meniscus tear. So not partial, but complete. So what do you do? Okay, well, here's the good news and bad news. Let's start with the bad news. A little bit about the medial meniscus is it's a fibrous structure. It acts as a shock absorber between the two bones that connect to the knee, right? The femur and the tibia. So when you're walking, when you're running, it's kind of absorbing that shock, so less of that stress is kind of going to that joint. It differs from the lateral meniscus because, unfortunately, the lateral meniscus has a better blood supply, and blood supply is going to dictate healing time. The medial meniscus doesn't have very good blood supply at all, and so that actually could infer that there is going to be minimal to no healing, unless you're a very young age. Young age would be less than 15 years old. Okay, so what do you do about that though, right? So I said that was the bad news. So here's the good news. The good news is you could actually rehab for this. So yeah, you're probably going to get pain in certain movements in certain scenarios, like if you kind of squat and do a twist too quickly, that will probably bring on some symptoms. But if you can stabilize the knee using your dynamic stabilizers, which are your muscles, you can actually compensate for the lack of the medial meniscus. Okay, so there's a lot of factors here, right? Like for example, the question is it's a 60-year-old female. Do you really want to do surgery on a 60-year-old female for her medial meniscus? So questions to ask would be like, what's her lifestyle? If she is sedentary, she's not really moving around, I would say, what? I don't know why you would fix that. That's not the surgery, but still. Versus if you have someone that's like really mobile, they're going out every single day, or maybe just every couple of days. They're going to like a bug club, they're going to community events, right? They're just someone that wants to be moving around. I would actually recommend like find a way to get that knee surgery or like get that medial meniscus repaired. But for those that don't want to repair the medial meniscus, you can you're going to have to look into rehab, and so that's what we will discuss today. So the very first thing that we kind of have to look at is knee mobility. Knee mobility has to do with bending and extending that knee, right? If you don't have full bend and you don't have full extension, you're essentially going to be considered like stiff. And if you're stiff in certain movements, you're going to experience discomfort. So for anyone new here, I just want to introduce myself. My name is Dr. Patrick. I'm a physical therapist and OC. I am doing a talk show every Sunday for the next 16 weeks minimum, as well as doing a talk show Monday through Friday. I wouldn't call it a talk show, but I would call it like Monday through Friday. I'm doing a workout program where I'm showcasing my transformation from 23% body fat to 10% body fat. But if that's something that you're interested in, go ahead and check me out tomorrow or throw out a comment and we'll make sure to get to you. Back to knee mobility. So when we look at, there's my stingray, do you see that? Let's look at the legs here. Okay, we're at 121 legs. If you guys can give me 900 more legs, we'll feed them. We'll feed the fish with pellets. If we can get to 10,000 legs, we'll actually put in squid into the tank, and that will feed the stingray. Okay, going back to knee mobility. So, knee bending, okay? Flexion versus extension. You're gonna want both of them. It's typically known that extension is gonna be more important than flexion, just because it's more functional. You need full extension in order to walk. If you don't have full extension, that is going to impair your stance time with walking and with standing. So if you think about it, right, like if I stand up right now, if I bend my knee, right, if I'm always have my knee bent like this, I'm basically putting all of my weight on this leg. And that will, if anything, that will modify my posture, right? That could lead to hip pain, that could lead to back pain, which could all the way lead up to like shoulder pain, right? If you're kind of twisted all up. So one thing that I really want to do when I'm rehabbing the knee, specifically the meniscus, is I'm trying to gain full range of motion in the knee back, okay? Full 180 degrees, okay? Once I accomplish that, let's see. Sorry, I can't really see the screen. I was looking at the screen. Once I have full extension, range of motion, I go for flexion, okay? The reasons why you want flexion are, if you think about it, like if I'm sitting here right now, this is easily like maybe 110 degrees of flexion. If I'm going upstairs, you're gonna want at least like 90. When you're walking, you are using a minimum of 70 degrees. If you don't have this range of motion and you try to do these movements, that's eventually just going to lead to some sort of symptom that could be described as pain or discomfort. And one way to get rid of that is to gain full mobility. There's a lot of different ways to kind of test for mobility. It's actually super easy, right? With knees, especially with the knee, right? It might be a little bit more confusing with other joints, but the knee is easy. If you can make your knee completely straight, that's 180 degrees, okay? If you can bend and have your heel touch all the way to your bottom, you're gonna be more than 150 degrees. If you're close to it, you might get close to like 130 degrees, which is completely fine. It's when you have less than 120 degrees, things get a little bit iffy, okay? So, quick reminder, guys, this is a talk show, and I would really appreciate if you can hit the like button. This brings our page to the For You page, I believe, and this just helps us out a lot. Also, I am doing a live Monday through Friday where I do a workout. You can watch it and follow along the entire time. I'll be doing it for 16 weeks where my goal is to go from 23% body fat down to 10% body fat. So let's go back to the knee. Let's look at strength training, okay? So we're actually going to step away from the knee a little bit. Let's just talk about strength training. Do you guys know how to set up a periodized program? Do you know what sets are, and do you know what reps are? And I don't just mean like, yeah man, sets are how many times you do it, and reps are how many times you do it in that exercise. It's like, okay, no. Like, do you know how to program your workout? If you are trying to go for hypertrophy, right? If you're trying to go for size, do you know how many sets you should be doing? Do you know how many reps you should be doing? What about if you're trying to go for power, right? You're trying to improve speed. You're in some sort of sport that requires it, right? Hockey, lacrosse, football, anything that requires jumping, right? You're gonna want power. I really hope if your goal is to improve power, you're not mistaking the parameters, the sets and the reps for hypertrophy, right? And you're not mistaking it for endurance. Like, you want to be as intentional as possible with all of this. So I bring this up because I guess I was kind of leading you guys on. A lot of people get it wrong. So let's stick to something easy, okay? So hypertrophy. Hypertrophy can be thought anything of as sets 3 to 6, and then reps anywhere from like 6 to 12. Okay, versus power, you're gonna want reps to be somewhere between like 3 and 6. And then your rest times are going to vary greatly. With power, you're going to want like 5-minute rest times, right? So there's literally like no rush. If you try to rush it, you're going to change your lift because it all depends on the output. If you're going for hypertrophy, rest time is more like 90 seconds, 60 seconds, right? Somewhere around there, 60 to 90 seconds. If you're going for endurance, rest time can be anywhere like 15 or less seconds, which is kind of crazy. So my recommendation is trying to figure out what is your goal at the gym. Is your goal just aesthetics, right? Are you trying to just like look good? If you're just trying to look good, I would recommend looking something up under the term of like the golden ratio, right? Golden ratio would say there's like specific proportions that you should try to achieve because they're a little bit more aesthetically pleasing. One way to kind of do that is to do also measurements, but that'll be a later topic. Let's say that your goal is you want strength. Okay, sorry, I got a little distracted there. All right, let's go back to strength. Let's say that you're going for strength because, I don't know, you're just trying to be able to lift something super, super, super heavy, right? Well, let's train for that. I know I was going a little bit fast, so if you guys have any questions about parameters like sets and reps, just drop a comment, or you can also DM me later. Also, by the way, we are releasing emojis and our subscriber program. Essentially, if you join our subscriber program, the first 10 subscribers, they get a free copy of the Dad Parent Bod Transformation, which I will be releasing in the next 2 weeks. And then if you give us 2 roses, we'll also be sending you a cool little gift. Okay, thanks guys. So let's get back to the show. Hey, we're at 221 likes. Again, guys, I know it's tiny. If we can get to 1,000 likes, I will throw in some pellets in the fish tank. You kind of see the fish kind of moving around a little bit. If you can get us to 10,000 likes, I will throw in a frozen squid and feed the stingray. So that's pretty cool, right? In addition to that, it would just really help us out and put our page on the For You page. Okay, going back. So strength training. We just talked about what's a rep, what's a set. Well, what's a periodized program, right? A lot of people know it as a basic like chest, tries, back buys, leg, shoulder day. But really, periodized program just means splitting up the exercises by groups, right? Not doing the same exact exercises every single day, because that's not something that we want to be doing. Something that we want to be doing is we want the consistency, but we also want to be hitting all of the major muscles. We have over 650 muscles, and that's not something you're going to be able to do by hitting or by doing the same exact exercises every single day. That just doesn't work out like that. So what do? Well, I'd say work backwards. Say, honestly, tell yourself, how much time can you devote to working out, right? Can you work out 6 days a week? Can you work out 5 days a week, 4 days a week, 3 days a week? Then from there, how long can you work out for? Can you work out for 20 minutes? Can you work out for 40? Can you work out for an hour? From there, you actually have a recipe. Like, let's say that you can work out for 4 days a week and you can put in 40 minutes each of those workouts. Okay, there. That sets up your template for your periodized program. You're basically going to be doing a 4-day split routine. Okay, like I said, you want to be hitting the major muscle groups. So with a 4-day with a 4-day split routine, I'd probably go like upper body, lower body, like day 1, day 2, and then repeat that. Upper body, day 3, lower body, day 4. You can't be as specific as like a 6-day split routine, but hey, 4 days better than 2 or 3. Then from there, you have 40 minutes, right? Does that include the warm-up? That's something to kind of think about. Does that include transportation, like going to the gym? Like, if it takes you like 20 minutes to like warm up and get to the gym, that means you're essentially only like lifting for 20 minutes, bro. That's like nothing. You know what's also nothing? Not getting to 10,000 likes, because this stingray wants seconds. He was already fed today, but I think he wants to eat again. Okay. Where was I? Okay, going back to the periodized program. So, let's say the lady, the 60-year-old female that has a complete medial meniscus tear. She has 4 days available to her because she still has work as a gardener, supervisor. Sorry, a little bit distracted there. I got a text message. Let's go back. So 60-year-old female that has a complete medial meniscus tear, and she's a gardener. She can only devote 4 days a week to us, and each of those days she can only do like 40 minutes of a workout. Okay, so let's build the program, right guys? We just have one last thing to kind of talk about before we start talking about those exercises. So let's see. Cardio. Cardio is another way of saying like walking, transportation, right? It's not like you're doing cardio to like burn calories. It's just like you need cardio in order to move from point A to point B. If you have no cardio, you're gonna be like tired walking from your car to the building. And you might think that's not realistic or that's a little funny, but it is. I mean, it is realistic and it is not funny. I have a lot of patients that actually have a hard time just going from a park position and walking less than 200 meters. If you can kind of fix that now and prevent that, that makes life a lot easier. Okay, so going back to the cardio. So this lady, the question would be, how much cardio should this lady be doing? So it's going to rely on two factors here, okay? The first factor is going to be obviously pain. The major rule here is you can do the movement as long as it doesn't increase your pain above your baseline, okay? Let's say your pain level is a 6 out of 10. If it is a 6 out of 10 when you start your exercises, whatever exercise or movement that you do, as long as the pain stays at a 6 out of 10, it's completely fine. It means the pain has not changed at all. If the pain reduces from a 6 out of 10 to like say a 4 out of 10, amazing. I would say do that exercise more. Like do that every single day. However, if that exercise brings your pain from a 6 out of 10 to like an 8 out of 10, that means you need to stop. If you keep going, you are just going to irritate that source tissue. So that is one rule to stick by, okay? Or one factor, pain. What is the second one? The second one I wanted to talk about today is, and you may have heard about it, is PRE or RPE, rate of perceived exertion. It's a fancy word, right? Another way of thinking of rate of perceived exertion is heart rate, right? Everyone has these fancy watches now, but at the same time, you can also get your heart rate by just taking your two fingers and putting it up to your neck, okay? Once you feel your heart beating, right? Like dum 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 dum, take that recording, okay? Every exercise, including walking, you want to be within a certain amount of the perceived rate of exertion. If you're always at 100% or higher, you're not going to be able to complete it. If you're always less than like 40% of everything, you're not going to get better. Okay. Again, what the question would be is what percentage of this RPE should I be going for, right? Should I be going for 50 to 65%? Should I be going for 65 to 80%? It's like, what the heck does that even mean? So, it all depends on your baseline, okay? Kind of an easy way of saying this would be like, your goal should be to be working out so you cannot carry a conversation with someone, okay? If you can carry a conversation with someone, you might be able to go a little bit harder, okay? At the same time though, if you feel like you're passing out, like you're seeing white, like the sound is like going mute on you, I would actually say stop. You are mid syncope, or that's another fancy way of saying like, hey, you are gonna pass out. Hey, check it out, we're at 550 likes. I totally appreciate it, guys. This is a family business, and this is one way that I can help kind of feed the family and feed the fish, right? Likes get us onto the For You page, and then from the For You page, it gets us more people watching us. And I can continue doing this show. Anyways, let's go back. So, exercises. Let's put this together. So we have a 60-year-old female with a complete tear of her right medial meniscus. Her pain occurs with walking up the stairs, down the stairs, and getting out of the car. Time of injury was about 3 months ago, and she already went to the orthopedic doctor, and she is cleared for physical therapy. She wants to try physical therapy before she even considers surgery. Surgery is an option because she is an active woman, but at the same time, she doesn't want to take a big risk. What exercises should we start with? So, kind of reviewing the board already, let's start with mobility, right? What is flexion, what is extension? So, we are going to assume that this female here has inadequate knee flexion and inadequate knee extension. So knee extension should be 180 degrees. She's presenting with about 175 degrees, or lacking 5 degrees full extension. Okay. Her knee flexion right over here, let's say that it's going to be about 90 degrees, mainly because of pain. Anything more than that, it increases her pain even more. Again, remember, we want to have at least 125 degrees to be completely pain-free. Walking, you need a minimum of 70 degrees. So the fact that she has 90 degrees tells me that she can walk okay, but if she ever goes up the stairs or bends down really at any level, that is just going to irritate the knee. So, we need to improve her flexion, we need to improve her extension. What should we do? Does anyone have any guesses? Anyone have any ideas? Let's take a look at the comments section. I don't know how to move this. There we go. Okay. So, first things first, heel slides, okay? So lie down on your back. I love Winter 50. Hey, lunges. Lunges are a great way to get knee flexion. Yes, that is correct. So let's modify that just a little bit though. Normal lunges do require a little bit of weight bearing, and we don't want to bear weight on that knee joint quite yet, especially if her range of motion is limited. If we can't weight bear, right, what do? We apply a little less pressure. So what you can do is actually, instead of doing like a single leg lunge, maybe you can do a double leg, okay? And it's like, what does that look like? Child's pose. So you can actually get down on all fours, and then you're gonna bring your buttocks close to your heels. If you guys can kind of picture that yoga position right there, right? And what happens is, by doing that, you get this really big bend in your knee, and you can actually control, right, how much of a bend you get, right? If you're just kind of up, you're closer to 90, but then if you can bring your heels to your buttock, you're going to be over 135 degrees, which is amazing. I would prescribe to this patient here maybe like 6 sets of 30 seconds to 1 minute of child pose that she can tolerate, and to build up, right? Like first set, don't go crazy, like just barely do it. And then if you can go into like the 3rd, 4th, and 5th set, like go hard. Try to get as much range as possible. And then do this throughout the day, right? You're not, one thing I want to mention is you're not going to get the range in a day. You're not going to get the range in like a week. Like imagine that you're going to get this range over the course of like a month. And so like budget the pain, right? Like ease into it. The goal is to eventually get pain-free, so don't force unnecessary pain on yourself. Hey, good, I love child's pose too. Another one is a lap pose in child pose. All you do is you go from here, and then you take one hand, and then you put it on top of the other hand. And then that will actually bias one of your lat muscles. If you're in child pose already, super easy to do. Throw that in there and do 2 sets of 30 seconds on each side. Okay, going back. So we came up with an exercise for flexion. Now we're going to come up with an exercise for extension, okay? Heel slides. Okay? You're going to lie down on the back of your, or like on your bed or something, right? And you're literally going to slide your heel away from you and toward you. When you slide your heel away from you, you're going to push down into the table, and that's going to create an extension force. Yes, good, good. Keep watching the show. I have a lot to teach. The heel slide You're gonna repeat that at a minimum of 4 sets of 20 repetitions every single day. Again, try the first set, like ease into it, right? Don't force anything. Around the 3rd and 4th set, that's when you start kind of adding a little bit more pressure. So I know, right? The more you know. Funny enough, something I learned is, and this is through my own personal experience, the more that you learn, the more that you realize what you don't know, right? Like before I became a physical therapist, I was actually a personal trainer at 24 Hour Fitness. And when I was a personal trainer, I thought, wow, I know so much, I know everything. Then I went to physical therapy school and I realized, like, oh my God, I know nothing. After 6+ years, I have slowly attained just a little bit more information, but there is so much information out there. And so really, my recommendation to everyone is just keep learning, right? It's your body. The more that you learn about your body, the more you can apply to yourself, and the more that you can help yourself. Absolutely, absolutely. Okay, so going back to the knee. So extension rate, the heel slides are for extension range of motion. The child pose is for knee flexion range of motion. I would say that you're going to do this for a minimum of about 2 to 4 weeks, and the goal would be to get full range of motion. Once you have full range of motion, right, knee mobility, you can now start strength training, right? This is controversial. People will be like, well, hey, how come you didn't start strength training before? Okay, so realistically, people are inherently lazy. If you are like super, super type A, then yeah, sure, you can start strength training. But majority of the time, people do not complete majority of their exercises. So when you give them the mobility plus the strength training portion, they end up just focusing on what they like, which is the strength training, and then they just completely ignore the mobility part. So what you have is you get lost range of motion, and after 12 weeks, patient's still in pain, and you know what? You're the one to get blamed, so no. You need to get mobility first, which really doesn't take that long, again. Unless you had that condition for like years, then that could take a while. So let's go back to strength. So for the knee, let's assume that her range of motion is now normal again. Normal being like greater than 130 degrees, pain-free, and then 180 degree extension, pain-free. Weight-bearing and non-weight-bearing. Exercises for that would be, you definitely want to be hitting your quad muscles, right? And you definitely want to be hitting your hamstring muscles. You want to be hitting your glute muscles, especially because the glute controls knee mobility, right? From kind of this movement left and right over here. If you're lacking any of those areas, you're gonna have instability in the knee. I'm missing a ton of other musculature, but those are kind of the main three. Like another one that you also need to hit is your calf muscle. So let's go backwards here, right? So we know that this lady isn't going to work out every single day, and we know that this lady isn't going to be working out like 2 hours a day. So we're not going to give her every exercise known to man. We're going to give her exercises that are specific to those muscles that she needs, which is the quadricep, hamstring, glute, and calf muscle. So first things first, let's go with the quadricep. My question is always, or my goal is to find a baseline. It's not to find like it's not to get a personal record that same day. And it's not to like, I don't know, stroke someone's ego. It's literally to get a baseline, even if it's like super, super low, right? Like for example, if it's only like 1 rep or 1 set, that's okay, because you're gonna use that to grow. After like a week or 2, you'll get 2 sets, then 3 sets, then 4 sets. The goal here, or the secret, not even a secret, right? I feel like everyone has been telling this since like we were kids. Like it's patience. It's progressive overload / patience and commitment. So I would say start with a bridge, right? What is a bridge? A bridge is when you lie down on your back with your knees bent, and then you're gonna push down with your heels, and then you're just gonna lift your butt up in the air. I wouldn't say necessarily go up to like 100% height first. Like start with like 50% and then 75%. The goal here is to be pain-free. If you can be pain-free at the 50%, the 100%, then go for the 100%. And then especially with rehab, you want to be careful with your reps and sets, right? Like if you don't really have pain, then you can shoot for like hypertrophy, power, you can shoot for endurance, right? But bro, you are in rehab. You have a completely torn medial meniscus. So let's bring it down, okay? So for that type of situation, I would actually say 4 sets of 4 repetitions, pain-free, okay? And you have to reassess this every single day. Hey guys, we are at 900 likes, super close to 1,000 likes. If we can get to 1,000 likes, I will be dropping in some pellets and we are gonna be feeding the fish. If we can get to 10,000 likes, I'm gonna be dropping in a frozen squid, a piece of a frozen squid, and we are gonna watch my stingray have some dinner. But don't worry, everyone's already been fed. This is just a way to get likes. Another reason to throw out some likes is just we appreciate it, and this really helps us. Going back to the exercises now. So first one that I gave you was the bridge. What does the bridge do? That really hits your glutes, okay, your glute max. The next one I would do would be supine clams. What is that? We're gonna take this. Okay, and then you're just gonna open up your knees and slowly come back. You're gonna repeat that 20 times, okay? I am so sorry, not 20 times. You're gonna repeat that for 4 sets of 4. And assuming that it does not increase above your baseline, then you're gonna slowly increase that up to 4 sets of 8, then 4 sets of 10, then eventually 4 sets of 20. This one is your gluteus medius muscle. It's like, oh, but Dr. Patrick, I thought we just hit our glute. It's like, yeah, you hit your glute max, now we need to hit your glute med. Like I said, there's over 650 muscles. Each muscle has a different movement and requirement in order to activate it. So, boom, we just hit 2 muscles. And we hit mobility exercises. So this lady has a total of 4 exercises so far. Remember, we can only work out 4 days a week for 40 minutes. What other exercises does she need? She needs quadriceps still, and she needs hamstring, and she needs gastroc/soleus, which is another way of saying calf muscle. So, what should we do, right? So, for the quad, the most simple one is, I bring this up to tell you that this is wrong, okay? People often prescribe straight knee rate or straight leg extension right here, and I would not recommend that. Mainly because this is open chain, right? It's not really that functional. When you're standing, when you're walking, you're putting weight on your foot, on your knee. That's the functional part. When you're in a chair and you're just kind of extending the leg, just like that, that's not functional. Like, you're strengthening your quad in a non-functional position. That doesn't help anyone. So, what's another way to strengthen the quad, okay? So, here's an assumption here. If you're a superstar, you're an athlete, you know how to squat, I would say sit to stand / squat. Unfortunately, there are more mistakes than I've seen people getting it right the first time. So I would say the easiest thing to start with is just like a wall sit, right? Like go up to a wall and pretend that there's a chair, an invisible chair, and you're just gonna sit into that chair. There's no movement at all. You're just holding that position for about 30 seconds. And what that does is it activates your quadricep muscles. My recommendation is let's start with like 2 sets of 30 seconds. You can't go 4 sets of 4 here just because it's not like a rep. It's more of an isometric. Isometric meaning you activate the muscle without movement of the joint, okay? So let's kind of put this together again. So we've got our 2 mobility exercises. We have our 2 glute exercises. We have our quadricep exercise in the form of either a wall sit or a squat / sit-to-stand. That's 5 exercises so far. We need our hamstring and we need our calf muscle. Calf muscle is super easy actually. You're just gonna go double leg heel raise, right? Sounds easy, but no one does it. Just do it. Hey, we just hit 1,000 likes. I just was not paying attention, so we are gonna take a moment and we are gonna feed these fish. Thank you guys so much for the likes. Thank you for the support. This really helps a lot. Let's see. So right over here, we have our automatic fish feeder. We're dropping in the pellets now. We have 8 different types of fish. This is a saltwater aquarium, 160 gallon. Underneath the aquarium is actually a 40-gallon sump, which is just another way of saying it's a second tank that basically filters the water. So the dirty water from here goes to the black thing, which goes into the sump. The sump filters the water and then sends the clean water back out. So that's how everything kind of stays clean. You'll see kind of the fish kind of moving around. And soon you'll see the stingray. If you guys can help me get to 10,000 likes, I would be happy to throw in a frozen squid and you can see a stingray. Yes, that's right. I said a stingray being fed. We also have clownfish, which is Nemo, and I forgot the name of the fish, but it's Dory. It's Dory, a blue tang. There we go. Okay, so let's get back to the main show. Thank you guys, I totally appreciate it. This really helps me explain to my wife that I'm not just like playing video games. And this is serious. Thank you very much. So let's going back to exercises. So what is a hamstring exercise that would be good for this patient? I would actually say hamstring bridges. So what is a hamstring bridge? A hamstring bridge is similar to a normal bridge, but the difference is instead of having your feet flat on the table or floor, you're gonna actually point your feet up. So your heels are on contact with the ground, but your toes are pointing up, and then you're just gonna drive your pelvis up in the air. Okay. This biases the activation of the muscle from the glutes to more of the hamstrings. So now we have 2 mobility exercises and we have a handful of strength exercises for the hamstring, for the quad, for the calf, and for the glute muscles. We are targeting mobility and we are targeting strength. It's like, wow. Look at that. That really was not that hard at all, right? And we even have our parameters set. Majority of them are 4 sets of 4 reps, unless it's an isometric exercise. Then it's going to be more like 2 sets of 30 seconds. But hey, how do we make it a little bit better? How about we consider cardio, right? Like I said before. What should we do in terms of cardio? Well, let's think about it. Like, what does this lady need to be able to do? She said she does a lot of trips at Costco. She has a daughter, she has a son, she has 2 dogs, she's always walking them. Actually, because of the dog, she's probably walking miles. So she needs to have enough conditioning, endurance, or cardio in order to fulfill the needs in her life, which I have just 1 dog, and I'm already saying like, man, you need like max cardio. So how do you start with that? I would honestly start with something super simple, like walk around. Actually, let me take a step back. One of the rules is, again, you need to make sure that the pain does not increase above your baseline. So once you understand that rule, then you can begin the goal of doing about 1 lap around the block. And during that lap, you're going to be mindful, okay? Do not focus on the ego. Do not think, come on, let's just get to 1 lap, let's get to 2 laps, do not get to 3 laps. Like, don't just force it, right? Let's be intentional about it. Like, as you're walking, it's like, okay, how's my knee feel? It's like, okay, I feel a little bit of an ache, but I think that ache is normally there. Okay. Versus, oh my God, I feel like someone's gonna saw off my knee. Like, oh my gosh, someone's gonna saw off your knee. Like, I would say stop. Like that's a contraindication. Like, don't do that. Once you can get to that baseline, let's just say for this lady it's 1 lap, you're gonna continue that for like 2 weeks, and then you're gonna slowly increase that. Okay, like let's go to 2 laps, then 3 laps, then 4 laps, in a very, very, very slow and gradual way. And if you can do this over the course of 12 to 16 weeks, your pain levels should reduce by more than 50%. Typically with my patients, they're anywhere from like 50 to 75%. And they also gain that mobility and that strength in order to go back to their lives, right? So again, this is all my answers here are all very specific to this case, which is a real patient of a 60-year-old female. If the patient was different, like they were a 30-year-old pro athlete, male or female, like you would have a different rehab program. The strategies would be the same. We still need to hit mobility. We still need to hit strength, right? But more than likely, you'll probably be working out 6 days a week. You could probably put in 2 hours a day, and you probably have a lot of resources at your disposal that an average Joe might not have. So rehab is for everyone, but you need to make it specific to yourself, right? Don't just go on Google and take the first thing you see on there. Fun fact, by the way, I heard about ChatGTP and I was super stoked, so I went on it and I did a little test. I was like, okay, let's see it. Let me put in a case of this patient, and I put in the symptoms, I put in the pain part, and I was like, okay, how would you rehab this patient? And I basically just like compared it to like what I would do. And their answers were so basic, but the answers were basically like from someone that's going to school. It's information that you're just going to get like from a Google answer. So going back to this, whatever you read online, if it's not specific to you, I would reach out to someone. Any medical, any physical therapist or movement expert, right? And seek out an answer that's specific to you and your issue. Like today we're going over the knee, we're going over the medial meniscus, but like if your issue is your hip, if your issue is the back or neck or the shoulder, I feel like everyone's got neck pain. Like go seek out a physical therapist, and it doesn't take very long. We just go through like an evaluation, and then we basically just tell you like, hey, these are the issues and this is what you need to kind of fix the issue. It's not scary, it just takes time and effort, which I guess could be scary. Like sometimes whenever I join anything new, it's like, oh my gosh, like how much time do you need from me? Like I could barely keep up. Hey guys, we're at 2.7K likes. I really, really, really appreciate it. I just want to let you know that Magno Physical Therapy is a family business. We rely very heavily on the community. And by throwing us a like, you put us on the For You page, which then brings in more people to us. So I just want to say thank you, and I totally appreciate everything. So we just kind of completed the knee. Does anyone have any questions about any of their own issues? We do have time. We have at least 10 more minutes to talk about anything, anyone, or like any entity that is specific to physical therapy / medical. I am a doctor of physical therapy, so it's within my scope of practice. Hey, no insurance too. Like seriously? Like, bro, no insurance. Can a tight psoas affect the knee? So the question is, what is a psoas, right? A psoas is a hip flexor. It goes from Depends on the resource, right? The resource I use, your hip flexors go anywhere from like the T12 all the way down to your knee. So what did I say? It goes all the way down to your knee. So if you have tight hip flexors, that is for sure gonna affect the knee. Like imagine, like I like to think of it like muscle is a rubber band, right? So if it's completely contracted, it's gonna want to force you into this hip flexion positioning. If you don't have that hip flexion positioning, it's gonna actually alter your pelvis. So it's gonna bias it more in that. I believe it's an anterior pelvic tilt. I'd have to double check that one. Or a posterior pelvic tilt. But regardless, it alters it. So what you want to do here is not only do you want to, I'm sure you've been stretching the psoas a lot, but have you tried or considered like strength training it? Like the basic to-dos or basic exercises that everyone kind of goes for is the straight leg raise. But I would actually recommend going more for your transverse abdominis because the hip flexor, right, is responsible for flexing, but your rectus abdominis is also responsible for flexing, right? It's just one's flexing the top half of your body, the other is flexing the bottom half of your body. If you can strengthen the crap out of your core, not only will you look like a superstar, right, especially with summer coming out, but you'll reduce the amount of stress and compensation needed by that hip flexor. And so by reducing the amount of force needed or output needed by that hip flexor, that'll reduce the tightness overall. And there you go. And then I would look up, excuse me, I just spit there. I would get on your back, I would squeeze your stomach muscles, and I would start doing with like bent marches, okay? Maybe 4 sets of 20 repetitions if you don't have any pain, right? Do that for a couple of weeks and then straighten your legs out, and then you're gonna do alternating straight leg raises or flutter kicks. And remember, the goal here is your rectus abdominis / core. It is not your hip flexor. And I do want to take a step back here. I said core so many times. I improperly said that. I mean abdomen. Core is, the word core is thrown around so much, but really the way that the core should be defined as is any muscle or anything that supports the spine, right? So yeah, the abdomen like supports the spine, but like your spine doesn't just have a front part, right? You have muscles on the side, you have muscles in the back, you have muscles inferior, you have muscles superior, right? Depending on who you talk to, I would actually consider like the pelvic floor and like your glute muscles part of your core. People would disagree with me, but hey, that's my definition. So going back to your tight hip flexors though, it's not necessarily like core muscle, but like hit your abdominal muscles. Beautiful, thank you, thank you. Does anyone else have any other questions? I have another 5 more minutes. And hey guys, I appreciate it. We hit 3.4K likes. This is a personal record. I went live for the first time last week and we hit 3K likes. So hey, totally impressed here. And I would like to say a big thank you to my moderator, Kathleen. She is a superstar who I also met on TikTok Live last week. Can you believe that? Crazy. Can I show you the hamstring bridge? Absolutely. Hey, let me actually bring it out over here. Let me move the hamstring bridge. Absolutely. Hey, let me actually bring it out over here. Let me move a couple things. Let me move a couple things. There we go. So, like I said before, The bridge is when your feet is completely flat, okay? Versus the hamstring bridge is when your toes are pointing up. So let me do the bridge first, and then I will do the hamstring bridge. So here's the bridge. Okay, straight line, feet flat on the ground. Okay, hamstring bridge, heel on the ground, toes pointing up, heel pushing down. Just like that. If you do have, if you are one that gets a lot of cramps, especially in the hamstrings, I would recommend with sets and reps of 4 sets of 4 repetitions. So we have 3 more minutes, guys. Feel free to throw up any questions. Totally appreciate it. I appreciate everyone. We got close. If we hit 10,000 likes, I said we would feed Stingray. So no snack for him today, unless someone wants to throw like 6.2K likes. I'm not sure if that's even possible. But we will be here next week. So I am on live quite a bit, but it's kind of like TV show. There's different topics every time. Monday through Friday, I'm doing workouts live. It's a 16-week project where I'm showcasing that if you do the right exercises, anyone can go from that parent bod to post-COVID bod to kind of that fit bod that they're looking for. It's just like doing the right exercises, doing the right steps, doing the right reps, right? And then on Sundays, I do this talk show, right? Next week, we'll be discussing the hip. If you guys have any issues, feel free to DM me or send me a comment, and we'll make your case part of this TikTok. Yeah, I live winter. Like I said, Monday through Friday for the workouts, and then Sundays for the talk show. And if you are interested, please subscribe or follow us. You'll always make a notification will appear so you don't miss out. We have 1 more minute, guys. Hey, we hit 4,000 likes. This is totally like exercising. Like if you just kind of progress a little bit more every single time, you will hit that goal. Thank you everyone. Hey, it's been fun. I really appreciate you guys. This was fun. Like I said, next week we'll be doing the hip, and then every week from there we'll be kind of doing a joint, right? So from the hip, maybe we'll do lumbar or low back, then we'll do mid back, then we'll do neck, cervical, then shoulder, elbow, ankle. If you guys have any suggestions, if like a bunch of you are like, yo bro, my feet like really hurt, I could totally skip like back and just go straight to feet, or vice versa, right? Just let me know. I'm here for you guys. So I appreciate it. This was fun. Have a good night, everyone. Thanks, Casey. You're the best.